From the nation's capital, welcome to Your Source TV. Be empowered, encouraged, and inspired to look beyond the ordinary. Welcome to Your Source TV. I'm Tamara Stuchlak, and in this segment, we're learning about the world of chiropractic and really next-gen chiropractic with a whole range of technologies from Dr. Sievers. Welcome, Dennis. Thank you for being here, and let's jump right in and hear about your background and then move into your philosophy. And I know you have lots of really educational and important information for us.
Well, thank you. Well, my background has always been, ever since I was a kid, that I was interested in the biological sciences. And so when I was around 18 years old, I wanted to decide whether I was going to go and move into medicine or if there was any way of turning into or practicing what's called vitalistic care. So for 4 years, I worked at Mercy Hospital in a cancer ward, and I was the nuclear medicine's gopher boy. I was his administrative assistant, so my job was to correlate the cancer treatments with hospice and cancer treatment and radiation treatment with chemotherapy. And after working 4 years in the medical model, I decided that it was not a good place for me because it was like corporate America. And what irked me the most was there were these cancer patients that were basically being treated, but the food that they were eating from the hospital food, which was dead vegetables, lots of sugar, fruit drinks, and desserts.
Complete disconnect.
It was a disconnect, you know, and basically nutrition has a role of making people healthy. And when I would ask the nurses and the doctors, well, why aren't you doing better nutrition with these patients that have cancer? Their remark was, well, what does nutrition have to do with cancer? And at that point, I had an injury, and I got healed by a chiropractor. I had suffered back pain for several years. I had medication, physical therapy. I had a couple of surgeons that couldn't decide whether they wanted to operate on me. I decided to go to a chiropractor with much trepidation because I didn't understand what the chiropractic model was all about. And after my father convinced me of going because I couldn't live on the medication anymore because of the side effects, I did get my first adjustment. And at that time, I had 50% relief of my pain. And after 6 visits, I was completely pain-free. Now, prior to that, I also suffered from pneumonia once a year, bronchitis 4 times a year, after they took my tonsils out because they said my adenoids were swollen and I would not be able to swallow foods. And I was always constantly getting sore throats. But once they took my tonsils out, I constantly got upper respiratory infections. So I was living on antibiotics for 10 years. But after I got adjusted by the chiropractor, I had no more pneumonia, no more bronchitis, not living on antibiotics anymore. And I asked him, what did you do to me? And he said, I made your brain tell your body how to work. I made your body tell your brain how it's working. And each of your visits, I told you how to clean up your lifestyle, how to have a healthy attitude, diet, exercise, and rest, because that's your best health insurance. And it helps your brain run your body better, and your body tells your brain how it's functioning. And
So
I
a
said,
whole person approach.
And I said, oh my God. And at that point, I decided to go to chiropractic school in Davenport, Iowa, Palmer School of Chiropractic, which is the premier and first school of chiropractic in the country.
So what is the chiropractic model?
Well, the chiropractic model is based on this. We are subjected to concussive forces of life, whether they're stress, whether it's viruses, bacteria, eating too much sugar, car accidents. It could be from eating too much arachidonic acid found in saturated fat. It could be too much
Slots.
Could be too much recreational drugs, or it could be too much medication. And ultimately, the body is not adapting to it, and the body then creates interferences. And so what happens is the spinal joints will disarticulate. Some joints will lock up on one side, other joints will overmove on the other side, and the overmoving of the joints are called subluxations, and they irritate the nerves, and each nerve in the body goes somewhere to an organ, muscle, or gland. So the brain has to tell the body how it functions, and the body tells the brain how it's functioning through the nervous system. So chiropractic is based on having your brain tell your body how it's working in real time, and the body telling the brain how it's functioning in real time, not too fast, not too slow, not too hot, not too cold. There's an operating principle called the Goldilocks theory. You want to be smack in the middle of your operating principles or your function without showing any overt symptoms.
So this is part of your the physical modalities and the technologies that you use, because you use a whole range of
Yes.
technologies for these various models that you're presenting.
Yes, so what I want to do is I want to restore the health of individuals. When D.D. Palmer discovered chiropractic, he said that the cause of interference or disease in the body is either from autosuggestion, which today we're going to equate emotional stress and stress reactions, toxicity, which is going to be basically bad food, pollutants, and unhealthy water and junk food, and trauma, which is going to be your car accidents, your falls, and your ergonomic situations, bad computer ergonomics, not wearing the proper shoes. There are some people that have dropped arches in their feet, which affect their posture. So we tend to take a look at, well, what is causing your subluxation? Where is the source of the interference coming from? Because just correcting the subluxation is treating an effect, but you want to find really what is the original cause of the illness.
So you use a specialized version of chiropractic. It's with low force?
Well, chiropractic is a profession where chiropractic means done by hand. Mm-hmm. So originally, chiropractic adjustments were done by the two hands, but now there are chiropractic instruments where you can actually deliver an adjustment with 1/10 or 1/10,000 of a second force. So in order to move a spinal segment, it's based on a physics principle, force equals mass times acceleration. So I have big mass, which are my hands, and I would have to use a moderate force to move a segment, which is comfortable in the hands of a good chiropractor because you're either a house painter or a Michelangelo. And so there are some guys that deliver it painlessly, and there are some people that deliver it painfully. Just like a medical doctor giving you an injection, is it painless or is it very painful when he delivers it? So there's an art to it. But now there is instrumentation, so I use an instrument called a torque release device, and it's based on the original principles of chiropractic, where we find these primary subluxations of the spine, and these primary subluxations
through x-rays, through feeling the back?
Well, originally chiropractic was based on motion palpation, feeling for joints that are restricted, so certain joints will be under moving, other joints will be over moving. That's one approach. X-ray would be another approach where we would be bending patients' spines left and right, forward and backwards, and we would see on the X-ray that a joint would be not moving, but that requires a lot of radiation, which is not my best way of detecting subluxations. And then there is also instrumentation that can actually tell you the level of where the interference is, either through some sort of thermography or some sort of surface EMG unit that can tell you where the interference of the spine. There are approximately about 30 chiropractic techniques out there, and I use a accumulation of about maybe 7 or 8 of them, because my adage is in dealing with my patients is I want to get you well in the shortest time at the least expense and permanent correction, if possible.
So why does chiropractic get a bad name from some people who view the model as, well, it's just, it takes so many treatments, or, the expectation that this isn't a preventive and an ongoing wellness treatment and approach versus the conventional medical model of one shot, you're in, you're out, take your pill, you're done.
Okay. Being that I've been on the medical model before it was the chiropractic model, I found that the medical model is based on the diagnosis and treatment of a disease. So you have a drug or a surgical procedure to treat the label. In chiropractic, we don't necessarily treat the label, we treat the patient. And the patient may have multiple layers of symptoms and diseases. So basically, patients are responsible for their attitude, their diet, their exercise, and their rest. So I have a chart that will talk about all the sources of toxicity that an individual can be affected by. So one could be affected by your genetic makeup. That could be influencing your health. You could have emotional traumas, hurtful subconscious things, which I call the resistance, resentment, and rejection of stress of personal communication. That could be a source of interference. It could be not enough vitamins and minerals, poor food. You could be eating a lot of inflammatory foods like too much grains, too much sugar, and that can actually trigger inflammation and result in the subluxation. Then there are people who basically wear the worst shoes, they have the worst diet. I call it the Santa Claus theory. I could be bad all year long with the worst attitude, diet, exercise, and rest, and the Pope, the government, or the doctor is going to bail me out, but that is not taking personal responsibility. Personal responsibility is, I am responsible for my attitude. I am going to get the proper rest. I am going to exercise, and I am going to eat correctly and drink pure water, and that there is going to reduce the amount of care that you need. But if you're not following a good attitude, diet, exercise, and rest, you are going to create more inflammation. You are going to cause more pain. There is going to be more treatment. Now, there are some people where I will treat them once, and that's all they need. I have other individuals who need a multitude of treatments, just like in physical therapy, they'll go 3 times a week for about a month in order to improve the flexibility, strength, and endurance of the spine. So with that, we adjust the spinal joints back in place. I also...
so you also bridge east and west also?
Yes, I do a form of acupuncture done without needles, and we use a device called an AcuGraph device that will actually measure the voltage in the acupuncture meridians. We don't stick needles in, but we use either a laser light of a certain frequency or an electrical device that'll produce 10 hertz, 100 microamps, or I may use gold or silver acuaids that'll tape on the acupuncture points, and that will evoke a healing response of getting the brain to recognize what's wrong inside the body and send the right message down to make the body function correctly.
So you're providing personalized care, and from a patient's perspective, how is it that, what's then a typical intervention, or what can a patient expect?
Well, when a patient comes to my office, the first thing they do is they fill out a symptom survey, and they tell me what their chief complaint is. And then I have them also fill out a metabolic questionnaire that lets me know what is the weaknesses in their constitution. So do they have digestive weaknesses? Do they have emotional weaknesses? Do they have psychological weaknesses? Do they have weaknesses in various symptoms of their endocrine system or their neurotransmitter system? And I also have them fill out a brain questionnaire to find out how well their brains are functioning. And also I figure out whether or not their neurotransmitters in their brain are properly balanced. So if you're low in serotonin, you're going to feel more depressed, dysphoric, unhappy, and you're going to feel more angry, irritated, and you're going to crave carbohydrates, and you're going to feel flat. There are other people that'll have a dopamine deficiency that will have a lack of focus and drive, and they'll also show some typical ADD or ADHD symptoms, which is called attention deficit disorder. There are other people that'll have an acetylcholine deficiency where their memory of remembering where they put the keys, what day of the week it is, and names. And
so you also do some unique testing to get to those imbalances as well?
Correct. But when it comes to brain chemical imbalances, you have to listen to the patient's symptomatology to determine how to improve that. There's no blood test or imaging test for brain chemistry. The same thing, as psychiatrists don't have a blood test to determine what medication you need for depression or anxiety. Now, in my profession, we don't treat depression and anxiety. We treat the underlying chemical imbalance that causes the depression or anxiety if it's not genetic or familial. Now, there are some people that have genetic issues of depression or anxiety or Alzheimer's or dementia, and their medication may be helpful, but nutrition is paramount in order to save the brain.
Wow. Do your patients feel a sense of then ownership, maybe greater ownership, because they're getting a whole range of lifestyles and technologies, but also you're putting them in their own driver's seat?
Well, here's what I tell patients. I tell them that you get well on 4 main reasons. A great doctor-patient relationship. You don't hold nothing back, and the doctor gives 110% or 1,000% of himself and is there to heal you.
Because it is a relationship.
It is a relationship, but you want a doctor who's not a businessman, but a healer mentality. So I tell them, I want to get you well in the shortest time at the least expense and a permanent correction if possible, but you have to be proactive. The second most important factor is the doctor's skill of figuring out what's wrong and healing you. Now, that could be proper diagnosis and treatment, but the word in vitalistic care is being healed, not treated. You can treat something, and once the treatment is done, the problem can come back. If it's healed, it will not come back. It is fixed and done with. So healing is the mentality, not treating. The third most important factor is patient compliance to doctor's recommendations. Are you going to follow through on the dietary recommendations? Are you going to do the exercises? If you're gluten sensitive or you're sensitive to sugar, are you going to avoid that completely, or are you going to cheat? And then the last thing is understanding what your illness is, what your part in it is, and how the healing art impacts, and what the doctor's role is, and what your proactive role is in recovering. So that could be a very short journey, or it could be a long journey, depending on those 4 factors.
What is energy healing?
Energy healing. Energy healing is I would call it a buzzword of where one applies a technique to improve neurological function within the nervous system so that the sensory brain, which basically sits in the back here, receives all the intel from the environment that comes in through your senses and all the information that goes into your brain from your body. And from there, your sensory brain talks to your hypothalamus talks to your limbic brain, which is your survival brain. It talks back to the hypothalamus. The frontal brain has to make a decision on all the intel, and then the intel goes down into the body, and the body decides to operate the nervous system in a normal tone, because everything in the nervous system is tonal. It has to operate on a 5, 10, 15, or 20 hertz frequency. So the sympathetic and parasympathetic nervous system has to be in balance. Then you have to have the proper soup of neurotransmitters that are being released from the brain. Then your body has to send out the pain-killing substances, so your body actually produces its own natural anti-inflammatories and pain-killing substances when it's released from the nervous system, and then the body also sends the right hormones to maintain the proper chemical balance in the body. So when you have achieved optimal homeostasis, you are the ultimate healing and repairing machine.
So in your protocols and your experience and treatment interventions, how is it that, because another of the challenges, you might say, around health and well-being protocols is that there's so many systems perhaps to address, and how do you decide to work on something first, second, and third, in what order and what modalities, and that's the art?
Yes, the art of it. So the art of it is that you want to always address the patient's chief complaint, because if you're not getting them out of pain and they're not seeing any results on the first or second visit, they're going to say, why am I doing here? Because let's say, for instance, you're in pain, you go to the hospital, and they're going to drive morphine in you. Lo and behold, in 15 to 20 minutes, the pain is gone, and you're saying, oh my God, I've been helped, I'm out of pain because of the narcotic. Now, basically, getting out of pain from a vitalistic model could be as quick as a morphine shot in some individuals, and as long as several weeks, depending on how bad the inflammation is, how deep-seated the condition is, and again, the patient's compliance to improving their pain. So basically, healing is a journey, and it could be a short journey or a long journey, depending on, again, the doctor's skill of figuring out what's wrong and doing the right thing at the right time at the right place, and the patient following through what the doctor had recommended and avoiding all the things that set the pain off. So if they can, if you can work together in a proactive model, the results are outstanding.
What are you hopeful for your profession and for the work that you're doing? And we're coming to a close here.
Yes. Well, patient education is everything. So talking to the patient and making them understand about how their bodies function and what their responsibility is paramount. And public communication about making public awareness about where the chiropractic model fits in the overall healthcare scheme. Because I want to give you an analogy. The first week I opened practice, I had 9 patients that came into me and they had back pain, but all 9 cases were not due to spinal problems. It was actually due to bone cancer. And once I found that they had bone cancer that was causing their pain, they had to have an immediate referral to an oncologist, hematologist, to have the treatment of that cancer that was causing their pain. So back pain and spinal pain and pains of the body may be mechanically and neurologically induced, but a lot of times they are pathologically induced. And when there is a huge pathology, the medical model comes into play of accurately diagnosing and treating that pathology. But again, you have to do the health model of your attitude, diet, exercise, and rest, removing the nerve interference, having the brain tell the body how to work, have the body telling the brain how it's working, to have a better outcome in the medical illness model.
Thank you, Dr. Sievers. We thank you for your passion and the excellent work that you're doing to really create personalized, whole person care that really treats root cause and puts the patient at the center. Thank you.
You're welcome.
Russia Today TV, where Russian and American businesses come together. To be listed on Russia Today's Business Connection, go to RussiaTodayTV.com. Olga Sheymov is an internationally acclaimed artist. You can see a virtual gallery tour at VladyArts.com.